Today I'm going to talk about a kind of cancers called lung cancer. So today I'm gonna use 4 parts to introduce the lung cancer. So let's get started from the part 1, the general introduction of cancers. So what is a cancer? It is a disease in which abnormal cells divide uncontrollably and destroy body's normal tissue. It is also known as malignant tumor or malignant neoplasm. In other words, something goes wrong in the cells when a cancer occurs. And also there's a figure shows you how the cancer develops. And also there's an interesting fact about the cancers. There are about 100 and 200 types of cancers. So now we know what is a cancer. So we can know what is a lung cancer. It is a disease in which abnormal lung cells divide uncontrollably and destroy normal lung cells. And it's so common in the world that some other common cancers such as breast cancer, colorectal cancer, and prostate cancer kills much less people than lung cancer. Here's some facts about how serious or how common is the lung cancer. So now we are going to talk about the causes of lung cancer. And now about the causes of lung cancer, I will do some microscopic analysis. The cancer arises from one single cell. The transformation of the dead cell is a multi-stage process. It occurs when a cell divides, or you can say it occurs during the cell division. Why does it happen? Because the cell ignores the external signals. There are several points that can induce the transformation of a normal cell. The first point is called the GAP1 phase checkpoint. It checks the surroundings and conditions, but sometimes we'll fail to detect a situation that goes along a wrong pathway. And that's how the cancer starts. So here is the second point, the GAP2 phase checkpoint. It checks the replication of the DNA. The cell can go wrong as well at this point. Here is the third point, metaphase checkpoint. It checks the chromosomes. But sometimes the cell fails to detect the flaws appear in the chromosomes. Figure 2.13 shows you what happens. So now we can conclude, if your cell finds some mistakes, there are 4 choices. The first one is resting automatically, it will stop. The second one is repairing the damages, it will recover itself. The third one is apoptosis, just die instead. And the last one, finishing the processes without corrections. That's how the cancer occurs. And also, viruses and bacteria affect your normal cells. Sometimes the viruses, DNA, or RNA affects normal cells' own gene, so cancer occurs because of viruses. So now we make a macroscopic analysis. So first of all, we're talking about what is a risk factor. It is a harmful factor which can increase the possibility of getting physical injuries or diseases. Here is an example. And what are carcinogens? There are substances which can cause cancers. There are 3 types of carcinogens. The first one is physical carcinogens, such as ultraviolet radiation. The second type is chemical carcinogens, such as arsenite. And the third type is biological carcinogens, such as certain kinds of viruses. Here, I give you some examples of risk factors of getting lung cancer. And some of the risk factors are carcinogens. So let's talk about how these carcinogens work, how these carcinogens harm your body. Here, exposure to carcinogens may form molecules in the body called free radicals, which damage cells and other DNA of the cell. This damage may cause cancer. So we cannot do this if we want to keep a healthy body. So here we are going to talk about the gender or the age differences in cancer. The gender differences affect the result a lot. Some types of cancers occur mostly among men, but some kinds of cancers happen mostly among women. This is a kind of lung cancer called BAC. We will talk about later. It occurs mostly among women who don't smoke. Sounds pretty weird, right? And also, it's not true that the old people will get cancers more easily than us. For example, this graph here shows you like some old people here, which is like 85 years old or 90 years old. They will get cancer much harder than us. So that is pretty weird, but that is the truth. So now we are going to talk about the symptoms of lung cancer. This is a little bit complicated, but it's okay. So first of all, we're going to talk about the types of lung cancer. Here, as figure 3.11 shows you, there are two types of lung cancer: primary lung cancer and secondary lung cancer. The lung cancer, which starts in the lung, is called primary lung cancer. And the lung cancer, which is caused by the metastasis or movement of other kinds of cancers, is called secondary lung cancer. But here it's getting more complicated. As you can see, there are 5 types of lung cancer. One of the type called non-small cell lung cancer, or you can call that NSCLC. It has 4 subtypes. Now we're going to talk about the stages of the lung cancer. The first one is the stages of the non-small cell lung cancer. There are several stages about NSCLC. From acute stage to stage 4. But there's only 2 stages in SCLC: limited stage and extensive stage. And here are some basic statistic data of these types of lung cancers. The first fact is, as figure 3.12 shows, there are 5 types of lung cancer. Each type is different, and NSCLC has 4 subtypes. The second one is NSCLC and SCLC are responsible for nearly 96% of all cases of the lung cancer. SCLC causes 10% to 15% of all cases. In NSCLC, adenocarcinoma is responsible for 40% of all cases of lung cancer. After talking about types, let's talk about the stages. Here's the question: how can we know the stages which the patients experience? We can know that by checking 3 things. The first one is the size of an original tumor. The second one is regional lymph nodes. The third one is distant metastasis. And we use a system called TNM system to record this. Here are some general signs and symptoms of lung cancer. Most of them are about the respiration system. There are a lot of symptoms of lung cancer, such as cough chronically, cough unstoppable, the shortness of the breath which is not related to physical activities, and the sounds of breathing is weird, and chest pain, a hoarse voice, chronic fatigue, headaches, painful lumps in the neck, and a lot more symptoms. But pay attention. These are bad signs and symptoms of lung cancer, but these can be caused by other diseases. But when you get this, you still need to find a treatment when several signs exist. The general symptoms are always related to the respiration system. Now, let's begin to learn the treatments of lung cancer. First of all, how can we prevent the lung cancer as much as possible? You need to remember two things. The first one is cancers cannot be completely avoided. But the second thing is the only thing you can do is reducing the risk factors of getting cancer as much as possible. For example, smoking and breathing polluted air. These are risk factors, but you can reverse it into no smoking and breathing fresh air. They are protective factors. There are a lot of risk factors. You need to change them into protective factors. But sounds easy. But it's really hard to do it. I have some bad habits. Doctors always use some kinds of technologies to diagnose the disease. Here are some examples, such as biopsy, molecular testing of the tumor, sputum cytology. Doctors use these to identify specific substances, and then they can know the particular type of the cancer. So now, after diagnosis, what about treatments? What about treatments of the lung cancer? Well, there's some typical examples of the treatments. Here, I give you 5 examples. As you can see, these treatments, all of them, have bad effects. Here is a 5th one. Even though these 5 treatments have bad effects, but don't forget, don't worry when you're diagnosed with cancers. Calm down. Never give up the treatments. Be optimistic, playing with your relatives. Just do anything relaxing. Happiness will give you different feeling. These have no side effects. And thank you for listening and watching. Remember to leave a comment. Thank you.